Alright, welcome back to another journal club from the Clinical AI Academy. My name is Nazal, and today we're discussing a study published on the 16th of April 2026 in Nature Health titled Public Use of a Generalist LLM Chatbot for Health Queries. The study analyzed over 500,000 de-identified health-related conversations with Microsoft Copilot from January 2026. That's remarkable. Not just the amount of data, but that it's only 3 months old, and the study was written, submitted, and published in 3 months. AI progresses fast, and publishing fast is needed to keep up. I won't get into methods. Link is in the description. Let's go through the figures. Figure 1 shows the distribution of health intents. Health information and education leads at around 40%, asking how medications work, what causes conditions, nutrition info. Many conversations were about specific conditions and treatments, suggesting users are leaning on this for personal decision-making. Next is research and academic support, probably doctors and researchers using chatbots to support their work. Figure 2 shows mobile versus desktop use through the day. I solely use chatbots on laptop, probably because I use them for research, but the pattern is interesting. At night, it's more mobile, suggesting personal use when hospitals and doctors can't be reached, while during the day, it's more desktop, probably for longer, more complex tasks. Figure 3 goes more granular. What users look for on each device. Usage differs, showing a split in personal versus professional intents. So again, more personal on mobile, more professional on desktop. Figure 4 confirms the pattern. Personal queries like emotional well-being peak at night, while info-seeking and insurance research drop in the evening. Figure 5 shows users sometimes ask about themselves, sometimes about family, friends, or unknown, meaning they don't state it. The more personal the topic, like emotional well-being, the higher the unknown category. Probably a signal about privacy and trusting the system with sensitive information. These were the main results. It's clear many are using chatbots for health queries, and more studies are needed to understand the usage pattern. It would be interesting to follow users and ask if they acted on these interactions. Did they start a new treatment themselves or change their plan without talking to their provider? That would show the real-world impact of these conversations. What do you think? How do you use the chatbots? Let me know in the comments. Thanks, and see you in the next one.